have been Medicaid's greatest strengths?
I think Medicaid's greatest strength is that it is said that it is reached out to the least advantaged segments of society by and large, though it has benefits in the nursing home and other areas that benefit the middle class as well, to the least some of the least advantaged sectors of this society. And it's a statement to them that in the face of a private insurance system where fewer and fewer employers are offering insurance, where especially if you work at low-wage jobs, you have no insurance, that we're going to put a safety net there. We're going to permit you to get enrolled in Medicaid, and the data are crystal clear. If you are enrolled in Medicaid, your access increases to care, that there are positive health outcomes, that people are less prone to get sick and candidly to die. There is good data to support that. So it's a lifeline to what are by and large some of the the least advantaged, or in the case of the middle class, people who've fallen on hard times because of nursing home costs, or they have children with disabilities who have astronomical expenses that they couldn't cover otherwise. So it's just a valuable lifeline to a lot of some 65 million people.
And what do you think the program's greatest weaknesses?
There's no question that Medicaid, in a lot of ways, is a bare bones program. I would say the biggest, that is, that it doesn't have some of the financial advantages of private health insurance or Medicare, which is, you all know, is a program for the elderly primarily. I would say the key issue is what we would call provider networks. Medicaid payment rates in most, not all, but most states tend to be below those providers can get from serving people on Medicare or people employed in a private health insurance plan. And therefore, especially among physicians, there are many, many states where getting access to care, even though you're signed up for Medicaid, and especially access to specialists, can be very, very problematic. And so even though the data overall show Medicaid to have very positive impacts on access, there are clearly issues around, I would say, particularly access to specialists that are less than optimal. And I mean, once things are bad enough, you get in a hospital, Medicaid is there for you, but most of us, if we have early stage cancer or some other disease of that nature, would prefer to work with a specialist to see if we can get it arrested before it reaches that kind of stage. So I think that's the number one problem in my view with Medicaid.
Some of the lessons learned through Medicaid's durability as a program be applied to other government programs?
I think the answer to that is yes. I mean, Medicaid does a number of things quite well, but I think the most interesting, or perhaps the most pertinent dimension of that response is that is to look at it compared to other federal grant programs. Now, there are many federal grant programs to the states to help disadvantaged people. Many of them, such as welfare payments to poor people, have eroded in services to poor people. And but Medicaid has been something of an exception to that, and I think there are lessons in Medicaid as to why, in the face of all this skepticism based on what happened to a lot of other grant programs for poor people, why Medicaid, or low-income people, why Medicaid has done pretty well. And for instance, one of the answers is that it has a funding formula that rewards states for investing in certain people rather than placing greater costs on them. There are other advantages that because it is such a big program, the governors tend to have a huge stake in it, especially around people with disabilities. the elderly who need nursing home care. If Medicaid wasn't there, and of course it has some provider support from nursing homes and hospitals and so forth, it would be very difficult for state governments just to walk away from these people. And as opposed to sometimes it's easy to hide poor mothers who need, a little bit of help financially. When someone just is incapacitated and doesn't have the money anymore, we haven't reached a point in this country where we just put them on the street and hope something happens to them. So there are a number of things. I've only touched upon a few, which I think are, I don't know, there's so much lessons as to what we can do with other programs, but they account for why Medicaid sort of stands out as more durable than a lot of federal grants to help the poor.